Welcome to the COVID-19 Vaccine Informational Family Forum, sponsored by the Autism Alliance. Before I introduce tonight's speaker, I'd like to introduce myself. My name is Allison Daigle. I'm one of the co-directors, joined by my colleague Pam McKillop, co-director, and Kathy Parkett, autism specialist. Thank you all for joining us tonight. We are so happy to introduce you to tonight's speaker, Dr. Mark Viron, Advocate's Chief Medical Officer. This workshop is scheduled from 6:30 to 7:30, with the goal of tonight's workshop is to provide updated information and answer questions families with special needs loved ones have about the vaccine. So I will turn it over to you, Dr. Viron.
Great, thanks so much. Really happy to be here with you all tonight, and thanks to the Autism Alliance for inviting me to come out and talk with you a little bit about the vaccine, and hopefully answer some questions that you might have or talk a little bit about the process. So a few things that I hope to do. I've got a presentation, and what we'll kind of do is go through the the current state of the evidence of the vaccines, talk a little bit about what the vaccines are they safe, are they effective, talk about some common questions that people have, and then go through the process of what it takes to kind of get a vaccine. What's the process for getting a vaccine in Massachusetts, and talk a little bit about some resources out there that might be useful for folks to know about. I'm going to share my screen here in just a second. All right, so COVID-19 vaccines, what you need to know. From the start, I'd like to put in a slide here to just acknowledge structural racism, ableism, and other forms of oppression. And just saying we recognize that historical and current structural racism, ableism, and other forms of oppression have made it difficult for some communities, such as Black communities and people with disabilities, to fully trust the public health, medical, and scientific community. So we want to be open and honest about the safety and development of the COVID vaccines, what we know and what we don't know, and hold that history in mind too, as we talk about people's individual decisions about whether or not to get a vaccine. The impact of COVID-19, it's been with us for over a year now, and the implications have been staggering. Some specific facts that I think are important for this group tonight is that people with intellectual and/or developmental disabilities are particularly susceptible to COVID-19 and the societal costs of the pandemic. People in these groups have more severe illness, have a greater risk of hospitalization once they get the illness, and are more than 2.5 times as likely to die from the illness when they get it. They're more likely to lose educational opportunities, healthcare services, and they're more likely to be among the workforce that is laid off or furloughed after the economic fallout from COVID-19. A lot of this has to do with risks from the underlying health conditions, congregate living settings are a risk, and difficulties with preventive measures and communication. So one of the tools that we have to kind of fight back against the pandemic, one of the biggest and best tools that we have are the vaccines. And so just talk basically about what is a vaccine. Well, it prevents disease that can be dangerous or even deadly. They work with your body's natural defenses to safely develop protection from a disease. It helps your immune system to produce antibodies, just like you would if you got exposed to the real illness, the real infection. And after getting vaccinated, you have protection from the disease without having to get the disease first. That's what makes vaccines such powerful medicine. It's not just treating or curing a disease, it's actually preventing the disease in the first place. What are the benefits of a COVID-19 vaccine? The vaccine is going to keep you and others from getting sick with COVID-19. All the vaccines we have right now, we'll talk about them in a second here. There's 3 vaccines. They're all been shown to be very effective and safe. It's part of what we're doing right now, or the other tools, masks and social distancing, are certainly helpful, but they're not enough, and they don't provide as much protection as adding a vaccine on top of that does. So it's the combination of really all of those things that's going to give you the best protection from COVID-19. And the more people that get vaccinated, the faster we can all get back to our normal lives. So what vaccines are available? So there's 3 right now, made by 3 different companies: the Moderna, the Pfizer, and the Johnson & Johnson one, also called the Janssen one. All 3 of the vaccines are safe and highly effective against serious illness, hospitalization, and death. There's some small variations as far as the numbers, and a little bit in terms of side effects, but the main thing to know is that the best vaccine for you right now is the one that you're able to get, because the supply is still so constrained that you're not really going to have a choice at this point in time about which one you choose. And they all have very similar efficacy and safety profiles. So they all work about the same. They're all just about have similar side effects. The important thing, some of the practical differences there, is the Moderna and the Pfizer take 2 injections. The Pfizer, you get them 3 weeks apart. Moderna, you get them 4 weeks apart. The Johnson & Johnson one is just one injection. So how do we know if the vaccine is safe? Well, the vaccines have to go through more testing than any other pharmaceutical, and that was just the same with the COVID-19 vaccine. The process was sped up, and we'll talk about how in a second, but no safety corners were cut. They went through the same rigorous process that any vaccine would go through at any other time. The steps that they take to make sure that vaccines are safe and effective. So you start with phase 1, and that's where there's small groups of people receiving the trial vaccine. And then in phase 2, they test it out among specific groups. When you get to phase 3, we're talking tens of thousands of people who are testing the vaccine for safety and efficacy. After that, after they gather those data from those large trials, the data gets sent to the CDC's Advisory Committee on Immunization Practices. It's an independent board made up of the country's best experts in this area, and they look at the data and make a determination if the vaccine is safe and effective, and then they give advice to the FDA. And then the FDA looks at that and decides whether or not to approve the vaccine. The vaccine's only approved after all these steps are done, and various teams of reviewers look at it to make sure it works and is safe. In addition to all these processes, Massachusetts also had their own separate process to look at all this data. So we had our own independent experts from across the state who were part of a panel that served to look at this data independently and make their own determination and a recommendation to Massachusetts about these vaccines. So how is it safe if it happened so quickly? We get this question a lot. The timeline was sped up, but safety corners were never cut. How could it happen as quick as it did? Well, a few things are important to know. One, we already had helpful information. Coronaviruses as a class of virus are not new to us. We've had several other coronavirus outbreaks in the past, so we kind of know about that family of viruses. So we weren't starting from scratch. Another thing to know is we invested a ton of money in making sure we could get these vaccines developed and out there and tested. And so certainly money helps to speed up a lot of things. And so they had access to, almost unlimited funding to get these things developed. One other thing that's different than other trials is that there were a bunch of people just ready and willing and able to get enrolled in these vaccine trials. A lot of what happens with clinical research trials is that it takes a long time to recruit people into a study, get them to go through the whole process. But we had a bunch of people that were ready to sign up right away. So the trials were able to get underway quickly and get finished quickly. And the other important thing that really speeds up this process, which is pretty much unheard of in how you develop a drug or a vaccine, is that the companies started to make the vaccine while they were still finishing up the testing. So they were taking a big risk that if it wasn't approved or didn't work, but we needed to take that risk because of how important it was to have these vaccines developed and available in as quick a time frame as possible. So they basically did that final stage of testing at the same time they were starting to mass produce the vaccine, and that doesn't usually happen in other scenarios with medications and vaccines. Who were the vaccines tested on? Tens of thousands of adults from diverse backgrounds, including older adults and communities of color and people with varying health status. They were intentional about this. They wanted the population they were getting to test the vaccine to kind of represent our general population as best as it could. The trials included people with disabilities who met study criteria. They didn't break it down by specifically what type of disability or diagnosis people had for some of these categories. So for example, you can't tell how many people with autism were enrolled in these initial trials. But the trials did demonstrate similar safety and efficacy profiles in people with underlying medical conditions, including things that place them at risk for severe COVID-19. And the other thing right now, like at this point, keep in mind, so those were the original trials. These were done last summer. We started getting the results close to the fall and then started getting approval back in December. And so now at this point, hundreds of millions of people across the world have had access to these vaccines and have had these vaccines. So that also helps us develop a greater understanding of how they work when they're outside of clinical research settings, and also the larger scale safety issues. And so far, what we're seeing from those studies, the kind of once it's out of the clinical research study, you continue to study the vaccine, you continue to look for side effects, you continue to get those things reported, you continue to do other studies. And really, you know, it's an area I keep up with, and almost all of the data, and I think to everything that's been reported right now is just reinforcing the idea about how safe and how effective these vaccines are. Do they have any side effects? Serious side effects from vaccines, including the COVID-19 vaccines, are really rare. It's possible some people may have side effects once you first get it, and that's normal signs that your body's immune system is building protection. These side effects might affect your ability to do daily activities. They usually go away within a few days. The most common side effects that people get are tiredness or fatigue, headache, pain at the injection site, muscle or joint pain, chills, nausea or vomiting, and fever. Sometimes it's worse for the second injection for those vaccines that require 2 injections. Sometimes the side effects are a bit worse. It depends on the person. As far as side effects go, the 1 dose Johnson & Johnson vaccine is supposed to be a little less common to have side effects, but it really depends on the person. And I think if anyone here's already had the vaccination, it varies by the person. My experience was pretty typical. I had my first dose, and about 12 hours after my first dose, my arm really hurt. I was feeling kind of like flu-like symptoms. I had chills in the middle of the night, woke up with a bad headache at 4 a.m., took 1 Tylenol, and actually went to work that morning. I was kind of nervous about the second dose, given that I felt kind of crummy after the first one, and all I was hearing, I got the Moderna vaccine, so it was 4 weeks apart. So everything I was kind of hearing was like, oh, I'm not sure how I'm going to feel. And it was actually a little bit less and maybe equal, but no worse than the first injection. So it almost followed the exact same pattern like clockwork. 12 hours later, my arm started to hurt a bunch, started to feel kind of tired, woke up in the middle of the night with some chills, and by the morning had a big headache, took 1 Tylenol, went to work. So it was interesting how patterned it was. And people's responses to it vary, but that's a pretty typical response to these vaccines. Are the COVID-19 vaccines safe for children? So what to know about right now about the current vaccines? They're only approved for the Pfizer vaccine is 16 and older, and the Moderna and Johnson & Johnson are 18 and older. Younger children and adolescents right now are not eligible to get the vaccine. That being said, there are ongoing studies in children less than 16, including some good news today about some of the initial trials that Pfizer is doing in children down to the age of 12, that the vaccine appears safe and really effective. And there's more data coming from Moderna and Johnson & Johnson. So the time frame for when we'll see it for younger people, the hope would be before the school starts this fall, is that there's something available, at least for those older age children, maybe at least 12 and up. But it's really encouraging. And so some of that news and research is starting to come out now. And hopefully in the next few months, there'll be enough data to review and get authorization for younger folks to have access to the vaccines. When the vaccines first came out, there was a lot of concern around allergies. There had been some anaphylactic reactions reported, not in the clinical trials, but in some of the early recipients of the vaccine. What you should know about it is that you shouldn't get the vaccines if you have a history of severe allergic reaction, also known as anaphylaxis. Those of us that have had those, it's pretty striking. You kind of know if you've had anaphylaxis before. It's a pretty severe allergic reaction to any ingredients in the vaccine. So The ingredient list is not very common stuff. One of the major things they're looking at is polyethylene glycol as one of the potential things that has caused some of these severe allergic reactions in some of the folks that have gotten the vaccines. But what we know from following the data afterwards is the anaphylactic response to the vaccine is really quite rare. 2 or 3 per million is some of the more recent estimates as they start to get more and more data. And just to keep that in perspective, the odds of getting struck by lightning is like 1 in 500,000. These are exceedingly rare reactions, but you should know your history of allergies. If you've ever had anaphylaxis, was it to any of these specific components that are in the vaccine? And so if you've had anaphylaxis before, do your research or talk to your doctors just to look at making sure you're not running into any situation. So I've had anaphylaxis before. One thing to know about I actually had it 3 times. So I was a little bit nervous about it because I was getting it around the same time all the headlines were about anaphylaxis. But one thing to know is if the anaphylaxis happens, it usually happens within the first 15 minutes and it's readily treatable. So any of the vaccination sites that you go to, they have it available on hand to both, they monitor you if you've had a history before of anaphylaxis for 30 minutes. Mostly everybody has to be observed for 15 minutes after the vaccine to watch for these reactions. And then they have to have on hand the ability to treat that right there with EpiPens or those types of things. So the good news is it's really quite rare. Take precaution. If you've had a history of anaphylaxis to any of the ingredients in the vaccine, you shouldn't get it. If you've had other types of severe allergic reactions and have concern about it, talk to your doctor about it. Can I get COVID-19 from the COVID-19 vaccines? No, absolutely not. The vaccines don't contain the live virus that causes COVID-19. It means you can't catch COVID-19 from the vaccine. But it's a common question. Will a COVID vaccine change my DNA? A couple of the vaccines, the Pfizer and the Moderna, are known as mRNA vaccines, that's messenger RNA. So I think it started some of this confusion around, well, does it change my DNA? No, COVID-19 vaccines do not change or interact with your DNA in any way. The vaccines teach our immune system how to fight against a specific virus. And to do its job, the vaccine doesn't need to get into the nucleus of the cell where our DNA is kept. So it doesn't interact with our DNA in any way and has really no way to change it. Another concern we get, especially for people who are thinking about getting pregnant, is I want to have a baby one day. Is it safe for me to get a COVID-19 vaccine? Yes, it is. People who are trying to become pregnant now or in the future can receive the vaccine once it's available to them. What we know right now is that the vaccines are safe for someone who's trying to conceive in the short or the long term. And there's no evidence that fertility problems are a side effect of any vaccine. There was some stuff being spread on social media about the vaccines and fertility that's false and was debunked pretty soon. But I think some of that's still out there, and it's caused this question to come up quite a bit. Should someone who is pregnant or breastfeeding get a COVID-19 vaccine? It's a personal choice. If you're pregnant or breastfeeding, you certainly are eligible to get the vaccine. The original trials didn't include anyone who was pregnant or breastfeeding. There were some people that happened to get pregnant while they were enrolled in the clinical trials. There were no adverse outcomes for that group that was in the trials. And the FDA and the CDC continue to monitor for side effects in populations who are pregnant and are choosing to get the vaccine, and who are breastfeeding and are choosing to get the vaccine. And they've published some of that data at this point, and they haven't shown any concerning safety signals suggesting that it would be unsafe to get. But right now there's like formal ongoing studies looking at pregnant people and people who are breastfeeding to look at that more thoroughly. So right now, the American College of Obstetrics and Gynecologists recommends that vaccines be offered to people who are pregnant or breastfeeding when they're eligible. We're still getting more data on it. So what we do know, the counter side of that, the risk, is that we do know that getting sick with COVID-19 during pregnancy can increase your risk of severe illness and increase the risk of adverse outcomes like preterm birth. So there's a risk and benefit to thinking through that decision to get the vaccine or not. And it's an important discussion to be having with your doctors. When can I get the COVID-19 vaccine? So now we get into the process of getting the vaccine. So in Massachusetts, what happened, it was given out in 3 phases. The vaccine started to be available around the end of December. You had to look at a chart that didn't really have any dates with it early on about which groups were prioritized. They broke it into 3 phases. The phases were made based on a few things. They kind of came together, the advisory boards, and tried to figure out ways to both preserve the healthcare system, right? Make sure it didn't collapse under you know, if you get all the healthcare personnel getting sick, or there's so many people in the hospital, you've got to protect that infrastructure. You've got to limit severe sickness and death. So you need to prioritize populations that are at the greatest risk for that. And then the other big part of that is to promote equity, make sure everybody has fair and equal access. This is the distribution timeline in Massachusetts, and this has been updated and changed over the past couple months, you know, quite frequently. But we've made it through phase 1 right now. Anyone who's in phase 1 is still eligible to get it. And this was really healthcare personnel, and also especially prioritized in there were congregate care and nursing homes and those kind of things. So at advocates, right, and throughout the state, congregate care settings had special distribution channels for vaccines and had pharmacies coming in to administer vaccines to all the programs and all the residents of programs and staff of programs. Phase 2, which we're in phase 2 right now, is mainly based on age, right? So if you're higher risk age groups, if you had 2 or more of the specific medical conditions that they've said make you higher risk, and we're kind of rolling through that right now. So if you see as of March 22nd, individuals 60 and over, people working in certain sectors. On April 5th, it's going to be 55 and older and people with one of the comorbidities we talked about. And by April 19th, which is coming on us in just a few short weeks here, everybody in the state will be eligible to receive the vaccine. So even if you don't fall into one of these categories right now, it's going to be open at that point. Now, certainly distribution and phases kind of, you know, it only matters really if there's supply. And as you know, the supply is still relatively constrained. It's still kind of tough to get a vaccine appointment. We'll talk about how to get those appointments, but the supply is still limited. There's a lot of encouraging signs that the supplies are increasing and things will kind of loosen up on the timetable. I think in the next month or two, that really it'll start to be much, much easier to get out there and get an appointment to get these vaccines. The certain medical conditions they talk about. So if we look at the phase 2 right now, right, you're prioritizing some of these phases if you have 2 of these certain medical conditions, or in an upcoming phase, 1 of these medical conditions. And there are a variety of things that it's not a, there are a variety of things that there's been at least some research done to show that it puts you at higher risk for bad outcomes from a COVID-19. Things like cancer, kidney disease, COPD, Down syndrome, various heart conditions, immunocompromised states, pregnancy, smoking, type 2 diabetes, asthma. These are things that the CDC notices and that the state has also said, yes, we'll include these on our priority list. It doesn't include everything on there. We talked a little bit at the start about how bad the pandemic has been for populations with intellectual and developmental disabilities and how high risk that population is. And there's a lot of data out there supporting it. And there's just a letter today that I think was signed by a handful, like 84 legislators in Massachusetts, kind of saying, hey, can we acknowledge the data and prioritize people with intellectual and developmental disabilities in phase 2 because of the data that supports it. So there are definitely some conditions on here that the data over time is going to show us are just as high risk as any of the other conditions that are noted here. But right now, this is like the official list for the state for determining these things. How do I make an appointment? So just to review quickly, kind of the nuts and bolts of this. So There's a website right now. So it used to be that you had to go on and sit online and like click and refresh and try to see if there's any available appointments and do it all hours of the day with hopes that you would get registered. Recognizing that that's not an easy system for a lot of people to navigate, the state did launch a pre-registration system in the last few weeks here. So you can actually go to the pre-registration site, put in your information, and then they'll keep you updated about when appointments become available, depending on where you fall in the eligibility criteria. It's useful because they'll send you a weekly text message to just kind of remind you, hey, you're pre-registered. We'll notify you when you're eligible and when there's an appointment available. And then it kind of holds your spot. So when there's an appointment open and it kind of links up with your eligibility, it'll send you a text saying, hey, you've got an appointment available. Go within 24 hours and sign up for an appointment. Right now, through the pre-registration process, the only appointments they're making available through it are with the mass vaccination sites. There's around, I think 7 or 8 of those sites throughout the state right now. Some of them they're not convenient for everyone by any means, but there's enough throughout the state. Later in April, they're going to release more of the appointments. They're going to kind of tie into the other locations that are giving out vaccines, like pharmacies or healthcare systems. But right now, pre-registration will only get you into an appointment at the mass vaccination sites. You can sign up on behalf of somebody. You know, if you're a family member or caregiver, you can sign up for someone else. So even if they're not able to navigate the system themselves, you can help them sign up. If you don't have internet access or someone to fill out the form for you, the state also operates the 211 line. So call 211 on your phone and you'll connect with someone on the phone who will take you through the pre-registration process. The other place, so the other appointments that are on there, so pre-registration, I think is the thing to do if you're looking to get registered and hold your place in line for the mass vaccination sites. There's also some other availability right now with the pharmacies. Pharmacies have a separate supply that they get, and they have their own scheduling system. You can go to this website, vaxfinder.mass.gov, and search through all the available appointments in any location. And then it'll take you to the specific site you have to go to register. This is where a lot of people are met with frustration right now, because you go on there any given day of time. Most of the times it's just going to say there are no appointments available. But that's where you can go to find all the places that you can get a vaccine right now. The thing I noticed today when I was looking at the websites is some of the places will list what type of vaccine is available. Like I said, for right now, because of the supply constraints, the best vaccine for you is the one that's available for you as soon as it's available for you. But if you do have specific concerns about a specific type or want to try to get a certain one, some of the sites will tell you what specific vaccine they're using and some won't. You might be able to find that out by calling up the site or others, but a lot of the sites on the website will list it right there and tell you other information about how accessible the site is, if there's any other services available there, give you numbers to contact folks at the specific site. 211 is available for this as well. And 211 has access to live people that will answer the calls, that speak English or Spanish, and also access to 100+ other languages through interpreters. If you are served by DDS, you can contact your DDS service coordinator who can help you if you're having any trouble navigating this process.
So Dr. Viron, we have one question.
Yeah.
Would you mind taking it? So one of the participants asks, I don't remember intellectual disability being on the pre-registration form. And did they redo the form or?
No, I think if we're talking about the certain medical conditions, it's not. Down syndrome is on it, but the very specific one.
Yeah.
But they haven't changed that criteria yet. I was just mentioning that there's been a lot of advocacy to recognize the intellectual disability and developmental disabilities as conditions that do place you at high risk. But there's been no formal acknowledgement of that from the CDC or the state's medical criteria. So it doesn't factor into your eligibility at this point.
Okay, thank you.
One other important program that was just kind of started within the last week is the homebound vaccination program. So in-home vaccinations are available for people who might not be able to leave their home to get it to a vaccine site, even with assistance. The criteria they're using are kind of roughly these. You require an ambulance or two-person assistance to leave the home, or you can't leave the home for medical appointments under normal circumstances, or you have considerable difficulty and or require significant support to leave the home for medical appointments. And that can include behavioral health challenges. They'll I wouldn't necessarily, oh, do I qualify or not? The number is set up. If you call that toll-free number there, that number is set up. You'll have an intake coordinator who will go through the screening process with you and help you determine whether or not you're eligible for this in-home vaccination program. And that just kicked off like last week. And if there's questions, as the questions come up, if you just want to stop me, I know there's some stuff in the chat, but just let me know.
Great. We have a couple more. So the next question is, how would you trust the pharmacies with vaccines needing very careful and cold maintenance?
Yeah, so you're referring to some of the vaccines require really stringent, like super cold storage things. The Pfizer, both the Pfizer and Moderna are pretty difficult to keep that cold chain storage. All the pharmacies and the mass vaccination sites, the state basically will only release these vaccines to people if they can meet the criteria. They've got the appropriate freezers, they've got the appropriate like chain of custody process for it. So all the places where these vaccines are available are able to meet those requirements. The Johnson & Johnson one is much easier to transport and to store. And so I think as production with that kit picks up, I think you'll see that one becoming more and more available just because the difficulties with the cold storage with the Pfizer in particular.
Excellent, thank you. And our next question, our 19-year-old autism spectrum disorder daughter has had 27 seizures to date, some while having a fever. If fever is a possible side effect of getting the vaccine, wouldn't logic then dictate that getting the vaccine can increase your chance of having a seizure if you have a history of seizures?
Yeah, so fever is not a super common side effect of the vaccine. Some people do get it. They're typically low-grade fevers. Some people get high-grade fevers. So it's a potential risk. Some folks would have it if they're concerned about it. Some folks will, if you talk to your doctor and they say, okay, given that risk, like, why don't you make sure to take a fever reducer after you get the vaccine, or to monitor your fever closely. And if it starts to rise, then take a fever reducing medication. So I think it's something with that thing, I'd kind of talk to your physician and see what the recommendations are. On the other side of it, right, COVID-19 can induce a fever as well. So I think you got to weigh the risks on both sides of that, of the vaccine and of COVID-19.
Okay, that's all the questions for now.
Okay. Important to know, there is transportation assistance if you do need help getting to or around a vaccination site. Mass Health provides free transportation for vaccine appointments. You can call Mass Health directly to schedule that transportation. All the mass vaccination locations are wheelchair accessible, don't require people to use stairs. There's drop-off areas, mobility assistance, and you can go to the website and kind of look through some of those things. Like I was mentioning, most of the locations on there, if you go on the website, they'll tell you what kind of accessibility supports there are for the different sites. Will I have to pay for the vaccine? No, the vaccine's free. If you do have health insurance, they will bill your health insurance at no cost to you. But if you don't have health insurance, you will still get the vaccine for free. You can get the vaccine even if you don't have insurance, a driver's license, or a social security number. Will getting the vaccine impact your immigration status? No, it won't change whether you're able to stay in the US, get a green card, or get public benefits like housing or SNAP. no matter what your immigration status, it's important for you and your family to be safe from COVID-19, so it does not impact your immigration status. What should I do if I experience symptoms after receiving COVID-19? If you have a lot of pain or discomfort, talk to your healthcare provider. Remember, the typical course is that you'll have some of these side effects, and within a day or two, they should pretty much resolve. If you don't have a healthcare provider, want to report any side effects to the CDC, they've got a couple different programs. One of the main one right now is called vSafe. It's an after vaccination health checker. You can sign up for it online. They give you the information usually whenever you get the vaccine at these sites. It's really easy to use a smartphone with it. They basically send you a text message that has a link to a website that you can fill in, and they kind of ask you to report if you've had any side effects, any other symptoms that you're noticing. And there's a lot of people that have used this, so the CDC is able to gather a lot of data from it's confidential, so they're not linking it to your name or anything, but they're able to gather a lot of data about how safe it is and what's happening as the vaccine gets out there amongst millions and millions of people. And they'll follow up with it. They'll send you a text like daily for about the first week, and then they'll send you a weekly text for a couple of weeks after that as well. And you can also go in between times to the website and click in and report any symptoms if you have concerns. How long after getting the COVID-19 vaccine does it take to be effective, and how long does it last? So the important thing to know when they talk about being fully vaccinated, meaning at its maximum efficacy of protection, you're talking a couple of weeks after the final dose. So if you get the 1 dose Johnson & Johnson, a couple of weeks after that, that's when it's going to reach its maximum protective efficacy. If it's the Moderna or the Pfizer, it's about 2 weeks after that last dose, that second dose. So that's important to know, right? Because someone can get infected with the virus just before or just after they get vaccinated and still get sick. And that's because the vaccine hasn't had enough time to build up to its maximum protection. We don't know how long the COVID-19 vaccines will provide protection. And partly that's because we haven't been with the vaccines for so long, right? To know that it works for a year, we need to have a year experience with the vaccine. Remember, the original trials just started last summer. But so what we know by looking at the kind of immune response the vaccine generates, it's likely months and months, if not a year or more, is what they're predicting. But we really need to verify that with studies out in the communities where the people are getting the vaccine. The other thing that's been in the news, that we continue to conduct more studies about whether the vaccines also keep people from spreading COVID-19. The original trials were designed to tell if it can prevent you from getting sick with COVID-19, which is a different outcome than trying to determine if it can prevent you from getting infected with the virus, right? So what we know from the clinical trials is that the vaccines are really, really good at preventing you, if you get infected with COVID-19, from having a severe outcome, meaning hospitalization, death, and getting really sick. We know they're really good at that. In the last month, there's been a bunch of data coming out from real world settings that show that not only do the vaccines do that, they actually prevent you from getting infected in the first place, which is really great news. And if you're not getting infected, you can't transmit it to anybody else. So it's highly likely that these vaccines are highly effective at not only preventing you from getting infected, but preventing you to spread it, from spreading it to everyone else. So that's an important point to note, is that the vaccine really not only protects you, but it protects your community, your family, and people around you. Do I need to wear a mask and avoid close contact with others if I have been vaccinated? Yes. As we continue to kind of figure out the protection that COVID-19 vaccines provide under real life conditions, we need to take all these precautions. Face masks, washing hands, staying 6 feet apart from others. There's guidance that's been coming out in the last few weeks that kind of talks about, okay, if in your family, this person's vaccinated and this person isn't, how safe is it to visit without distancing? And so some of the guidelines are starting to acknowledge that, if you've been vaccinated, then it's low risk for you to visit, potentially without a mask and without distancing in certain scenarios with certain people. So I encourage you to look at that and kind of understand what the guidance is saying right now as far as that. But in all the other general situations, right? So at your job or out in public, masking, distancing, small crowds, washing hands is still vitally important right now. And the thing to remember about that is because it's not just about how the vaccine is protecting you. It's the fact that the virus is still out there in a large enough number that, remember, the vaccine is not 100% effective. It's a really, really good vaccine. Its effectiveness is like over 90%, but that's still that 1 in 10 chance. And while all that virus is still circulating, it's still risky to be out. So in some of these situations, there's still risk involved. So we need to take all the precautions we can for now. Once the pandemic starts to fade away and the rates of infection start dropping, it's going to be safer to start dropping some of these other public health measures. And that's really what the public health folks are looking at as far as what are the CDC guidelines right now for being in public and needing a mask or distancing. And so it's a couple of things. It's going to be, as more and more people get vaccinated, and as the virus, the numbers, the levels of virus in the community start to drop, that's when it's going to be safer to start resuming some of these things without masking and distancing.
Dr. Viron, I have a question. One of the participants has a question. If I'm vaccinated and I'm with a friend who is also vaccinated, do we still need masks?
Yeah, so that's where the CDC guidance comes in. And what they've said is if you're kind of in a setting where you're around somebody who's been vaccinated and you've been vaccinated, that risk there is very low. And if you want to get together and not social distance and not use a mask, then it's going to be a low risk situation. And so they've said, and they've got a whole web page where they show you the different scenarios. And it's even potentially depending on the household mixture of who's in the household. I think the thing to take into account for some of these things is the risk of the other people who are not vaccinated. And so if you're entering a setting where people have more risk and aren't vaccinated, it's important to keep that in mind. But if two people are vaccinated, certainly they can kind of visit. And right now the CDC guidelines say that's a low enough and acceptable risk to go ahead and do it without masks or distancing.
Okay, thank you.
Who can help me make decisions about getting the vaccine? I've mentioned it a few times through, but if you have more questions about your own health or specific issues with you or a loved one, bring it to your doctor and really have a discussion about it. Bring it to someone that knows the health history and the specific issues that you or your loved one are facing, and get some answers to those specific questions. Communication is really important too. So I want to note some of the resources out there specific to autism or intellectual and developmental disabilities. We've got some of these social stories that as you're trying to prepare folks or help them kind of understand and get information about the vaccine, there's some of these websites out there that go through different social stories for things like what to expect during my vaccine. And they come with, pictures and straightforward text. Getting a COVID-19 vaccine, what to do after I get my vaccine. So there's some of these specific resources out there that might be helpful in talking with your loved one about the vaccine. And then just to leave you with some resources out there, the things that I recommend going to, the sites that are really good sources of information, mass.gov. If you just go to mass.gov, it's pretty obvious where the COVID-19 and vaccine information is when you get to that homepage, but they've got a lot of great resources, everything there about how to get the vaccine, what the information is about the vaccine, frequently asked questions that are updated regularly. That's a great source. And also the CDC website is a great source. And like I was mentioning, what's safe for me to do after I get a vaccine? They've got a whole page that goes through that in pretty straightforward language to help you know what's safe after you get vaccinated at this point. And they update that regularly too. So I'd encourage folks with more questions to kind of keep those sites in mind. And like I said, the pandemic and the vaccine and the information kind of grows day by day and changes. So keep looking back for updated information. These are all great resources to go to for keeping up to date. That's all I have. I think that's a lot. And so I think I'll stop there and open it up to any other questions that folks might have.
Okay.
I have a question if you don't mind me talking instead of typing.
No, and then after you're done, there's a question. in the
Okay.
queue. Yeah.
After I've had both my shots, and after my first shot, I had a regularly scheduled doctor appointment, and due to my age, she was going to give me the shingle shot and said, no, not if you're getting vaccinated. So I didn't get the shingle shot. My guy, who's 17 and is not vaccinated yet, needs his wisdom teeth out. So is there anything we shouldn't be doing in anticipation that he's going to get vaccinated soon?
Yeah, so the one thing with the different vaccines, they encourage folks not to get the like two different vaccines within, I think it's 2 or 3 weeks. There's specific CDC guidance about that. And that's just so you don't mix, there's nothing dangerous about doing that, but they want to know that if you're experiencing something, what is it from? And they haven't really, so to minimize the risk, they just say, try not to schedule those things too close together within 2 weeks. I think if you're getting your wisdom teeth out, I can't specifically think of anything that would make me schedule those things farther apart. Maybe not like the day after. You might be feeling miserable, and on top of feeling miserable, to go get your wisdom teeth out, which would also be a miserable thing. You might want to not lump those things that close together, just in case. But other than that, I don't really see a need for something like wisdom teeth to kind of interfere or make sure it's spaced out too much or really consider too much. But if you had any concerns, if you talk to the dentist office and see what they might say or what others would say, but I can't think of a reason other than like feeling doubly miserable from those two things at the same time.
But wouldn't, like, a lot of times you have to go on you may have to be on an antibiotic. So would that have any impact at all, Dr. Viron?
Yeah, no, because we're talking about a vaccine for a virus, and antibiotics are for bacteria.
Yep.
So I wouldn't be concerned about the overlap or interaction there.
Awesome. All right. So the next question, we are told the vaccine is not mandatory, even among healthcare providers, teachers, etc. Understandably, some would want to opt out. What happens to the rest of the population who are waiting for vaccination, or children in touch with these people who are not going to be vaccinated?
If I understand the question, I think it's more about, is it more about risk to people that might come in contact with people who are not vaccinated, or risk of people who can't get vaccinated yet?
Yep.
And their risk. Okay.
Mm-hmm.
Yeah, I think it's an issue with any vaccine we have, and so some people get it, some people don't. Right now, it's not mandatory. Will it be in the future? In some scenarios, it might be. It could be. Right now, what we're doing at Advocates is really pushing strongly on the advocacy side of things, providing people information, providing one-on-one conversations with folks, having lots of different opportunities to get the information and talk about fears or concerns. So we're really working more through that kind of nudging of folks rather than mandating the vaccine. But it does. I mean, I do worry about the same thing. If we talk about herd immunity, we need the most people to have the vaccine. And right now there are big chunks of the population, like kids, that aren't eligible yet, aren't able to get a vaccine. And we need to have as many people vaccinated as possible. And there remains some hesitancy out there, and for a variety of reasons. But yeah, I think it's an ongoing challenge.
Thank you. What exactly does 95% effective mean? Does that mean you have a 5% chance of getting COVID? Or does it mean a 5% chance of getting a serious round of COVID that could lead to death?
Yeah, so the way they do the calculations for this is they look at groups that have had the vaccine and groups that haven't had the vaccine or have had placebo, and then they look at the number of COVID infections, that the number of positive cases that come over time, and then they do the calculation from that. So it means a couple of different things. So the original trials were looking at the outcome, like preventing an illness, right? So preventing you from getting symptoms. So those were that was the 95% efficacy there. The recent studies that have come out are about infection, preventing infection. So they're over 90% effective at preventing infection. So it's two different numbers talking about two different concepts, but both of them are over 90%. So both over 95% that if you get COVID, it won't be a severe infection, and that in the first place, 90% chance that you won't get COVID in the first place. And keep in mind, it varies depending on the risk and community prevalence and how much is out there. And, you know, if you're in a room full of people with COVID versus like, you know, taking all the precautions and distancing and stuff, right? That's a different risk environment. But those are essentially the numbers. They apply to both things.
Thank you. Next question. None of the vaccines have preservatives, including thimerosal. No preservatives at all? Question mark.
Yeah, so you can go online and look at all the different the ingredient lists for the 3 ingredients. Both of the mRNA ones, and I believe also definitely no thimerosal in any of them. And I know the mRNA vaccines have no preservatives, and I'm pretty sure the Johnson & Johnson one has no preservatives as well.
That's great. Are there any sites that would have staff able to handle behavioral challenges?
It's a really good question. I don't know the answer to that question. I would imagine I would think about different ways to provide the support there. And I know there's some folks that need particular types of support, especially when we start, you know, not everybody's comfortable with needles, not everybody is thrilled to get an injection. So I don't know, maybe open that up to other folks too, who might have suggestions about doing that. I would think I would hopefully, you know, I might call ahead of time and be like, is it all right if I bring, you know, or just give people a heads up, or, you know, if you're super worried about it, and maybe thinking about what site would be best. If your loved one is more comfortable in, you know, a familiar PCP office, do you wait until your PCP has it available? You know, do you go to a quieter, like one of the pharmacies instead of going to a mass vaccination site? Do you bring particular support people with you? Do some prep work beforehand. Those are kind of things, but those are just kind of practical things. I'm not sure about the.
I know I was even one family member, I sent the information about the home vaccine program because they were describing some really challenging behaviors that I felt like, you know what, maybe this could be a better match. So that I think could be possibly an option. Yeah,
that's a great idea, Allison. And it doesn't hurt to call to get screened for that too, right?
Yeah. I mean, that's what I would do, because the vaccination sites like my son went to Gillette. I know some other people here went to Fenway. You know, it is very quiet. It is very quiet, and it's very quick. So in fact, what I think is really remarkable about Gillette is that there's a big clock in the front. So you sit there and it will say, now accepting patients or people for appointments at 11:12 or 11:15. And so you can sit there and wait, and you say, okay, now we're going to go in. So you literally walk right in, and once you go through a very brief registration, very brief, and then you go up, and there's just so many different people that are waiting to vaccinate you. So it's really like you almost walk right in, and there you go. And the process is very quick. There's not a tremendous amount of paperwork. You just have your license. You just show that you're there for an appointment, and there you go. So, I mean, that piece of it is I think very good. It's quiet, it's quick, it's efficient.
So I don't want to, sorry to ask, but so were there any questions about why you were with your son, or were you getting vaccinated at the same time, or?
No, there was no questions. I did. I went and got vaccinated at the same time because that reason. But they could tell if something was different about him because he just looks like he's different. So, but no one seemed to be too bothered by that. Let's put it that way. Una, you know, it was obvious that he was different, but it was very, very efficient, very quick, even though it's a big site. Yeah. Does somebody have anything else? Kathy, did you have your hand up? Oh, so, okay. Yeah. Would you like to talk? Can you talk, Kathy, or no?
So I know Fenway Park isn't doing it anymore, but at the place that's replacing it is probably the same. It was the exact same way at Fenway Park. People were so nice, so kind. They moved you along. It was very structured and organized, and I can say that there was no chaos at all.
That's great.
The vaccine's very quick too.
Yes, very quick.
Kathy and Allison, was there a waiting site afterwards, like a place after you got vaccinated, like a place for everyone to?
Yep. So there was a waiting site, and there were chairs that were placed, you know, the 6 feet apart, and you know, you could put yours with your child's, like I did, and then there was also a big clock that said, if you got your vaccine at this, then you can leave at this. You know, it kept changing so that it was very, very organized. And once you were done, the exit door, they just escorted you out the exit door and you were done. It was surprising how well run and structured it was.
I agree. Same here. Yep. Yeah. Just one other thing I was going to mention that to anybody who would be interested, but my son does have seizure disorder and has had several in the past, and that I was very nervous about that too. And so I asked his primary care physician and his neurologist both times. So I felt like, okay, I asked 2 physicians, and I, you know, should I do this? Is this the right thing to do? And both of them, without hesitation, said yes. So I think I was very nervous about that too, and I know I was ready with the Tylenol if needed, and that was going to be my strategy. And so I did not give him any change in his medication. I did give him his seizure medication before. Yep, in the morning before he went, I gave him his seizure med around 7:30. He had his vaccine at 11, and very similar to Dr. Viron, the side effects don't happen until probably 5 or 6, 7 hours after you get the vaccine. You start to realize your body starts to kick in, but no seizure activity and nothing in that area for either shot.
And same with me. Hold on, wait a minute. Same with me. There was, we took the seizure medicine as prescribed, as regular, and it didn't cause any fever or seizure.
My daughter also.
All right. And I actually I'm reassured now, because I feel like it's so much more unpredictable to get to have COVID and then not know, and then be, you know, the nervousness and worry around that was really, really high. So the next question, many of our Many of our families, individuals have spoken with their physicians if they needed a plan of pre-care and post-vaccination. Some did have plans. Thank you, Fatima. Thank you. Excellent. Fatima, do you know what the pre-care or the post-vaccination plans consisted of generally?
So some of our folks needed to have just like a plan of what may or may not happen, just to make, I think, the families more comfortable.
Okay.
A lot of our families did get nervous, especially with the fevers and the seizures. And some of the cardiologists, you know, just said, this might be the best option for you if you can't take a Tylenol or something like that. Because some of our folks have restrictions to certain medications and the ingredients.
Excellent. Thank you. Thank you for sharing that.
No problem.
All right. Does anybody have any final questions before we say goodnight? Other than this was amazing. This is really,
Mhm.
really, really fabulous. And thank you so much, Dr. Viron, for coming this evening and talking with us about this.
Yeah,
Very,
thank you so much for having me. I really appreciate the opportunity to come out
This
here
was-
and talk to everyone about it.
yeah, this was excellent. I think information and having the accurate information is really, really vital, critical. Okay. Excellent. Well, thank you all so very, very much
Thank you.
for coming tonight. Thank you so much.
Thank
Have a
you.
good night, everybody.
Bye.
Thank
Bye,
you.
thank you.
Bye. Bye, Nancy.